Hi guys, welcome back. Happy Monday. So this is the second part from last week's episode.
Anyway, so as we mentioned in last week's episode, I've been stressed out with clinicals. But aside from being stressed out with clinicals, there has been some positives to it.
Yay.
They're like, we're not gonna listen to them. They're depressing.
For real. I know we've been it's been a few depressing episodes, but anyways, so one thing I'm learning about being a nurse practitioner student is okay. Let me rewind, bring it back a little bit. So family members and even friends get so confused when I say I'm a clinical student. They think that I'm either talking to fake patients, doing stuff online.
That's
where
cute.
I'm not even in clinic. So I actually go into a clinic. When you go, and then real patients come in with symptoms and just checkups that they need to do.
Real conditions.
Real conditions
diseases.
that they need help on. Real follow-ups. This is not just in my head. I'm actually interacting with patients.
No
I'm
robots.
I'm actually creating, doing my charting and everything, pre-charting posts on real patients, not no imaginary. It's not for fun. I'm actually, like I said, the clinic is ran by students. It's my preceptor and 4 students are the ones that taking on the patient. Got that out the way. So anyways, I always thought it was so, not funny, but a lot of our patients that I see that comes into the clinic, they have diabetes, hypertension, hyperlipidemia, and a lot of the times it has a lot to do with their weight and their diet and what they're eating. So, and like I said, anyways. So a lot of the times I would have to educate the patient on the importance of proper nutrition, exercising, eating right and everything to reduce their A1C, to reduce their lipid levels. And I always felt like a hypocrite.
I was gonna say
a hypocrite. Because it's how am I telling my patients that they need to lose weight, exercise, eat right, and I'm over here eating pizza, hot Cheetos, cookies, everything.
I feel you on that because I remember when I was studying for the MCAT and studying for things, and I was like, okay, what am I doing this for? To be a doctor? What am I being a doctor to help take care of people and take care of the health? But I would eat junk for the weeks leading up to the test, and I remember being I'm a hypocrite. This is so wrong.
So bad. It's so bad. And I feel even though my patient doesn't say anything, but I was if I was the patient, I would look at you girl, you need to take your own advice. Yeah, who do you look like this and you telling me to do this to this. I was
I understand.
So, and I thought it was also really funny that, mind you, my preceptor is a tiny petite woman. She's super, super petite. And when we're in the room talking about the patient, she always says, look at their BMI. Because mind you, if your BMI is high or super low, it'll be red. So it'll flag your account. If it's red, your BMI, I had patients BMI is 30, 35, 45 in the
45?
Yeah.
That's a big BMI.
No, what do you think about it?
Yeah. See, Kathy, exactly. So my preceptor was yeah, look at their BMI. Ooh, they big. Okay. And I'm looking, I'm damn, my BMI is around that number.
I'm right there with
them.
Same.
Yeah.
Same, Kathy. Same.
Kathy can't relate. Let's just, tune her out. I was my preceptor would always point out the BMI. I'm looking at the patient's BMI. I was dang, my BMI is either at that or very close to it.
I'll tell you something, because I'm doing the transformation challenge at Orange Theory. I always knew, yes, I knew I was overweight, but when I started the transformation challenge, they put me on the scale, and it told me my BMI. It told me my BMI, and I was
there's no way.
I literally was there's no way it's that high.
No way.
When I tell you I was not expecting it to be that high, I was oh my gosh, I need to make a change. So
yeah, so that's where I come in. Same, I need to make a change. It's there's no way I'm educating my patient on healthy living, proper nutrition, and exercise, and I'm over here not doing any of that. adding stress to my life. Even talk to the patients about the importance of reducing stress. And my stress is at 1,000. My stress is causing heart palpitation. My stress is causing headaches. My chest.
Next thing you know, she's the patient at the clinic. Seriously.
So I was like, how can I tell all my patient all of this and I'm doing the complete opposite?
So what have you been doing?
So for me, I told myself again, I feel like I go back and forth, but to first of all, to put more time into myself, because I feel when I get overwhelmed, I just neglect everything.
You're not alone. I think
Literally
it's very
everything.
normal.
Yeah.
And it's not a good habit to have.
No, it's a really bad habit because I feel like it just leads you to spiral.
Yeah.
Yeah.
Until like it makes you feel like shit.
Yep.
Yeah.
And that's where I am. I've been spiraling since January. And I feel like I mentioned in the last episode, I got about a week off where I didn't have to go into clinic and I still had assignments, but I waited last minute to do those assignments. But that week I had time for myself. I had time to, like I said, work out, meal prep and everything. And that kind of reset it. It reset me to like now where the place I'm in now. So now I'm going to Orange Theory with Jazmin, which has been great. And that has been a stress relief in itself. It's been hard because I like to sleep in, but I go to the 7 a.m. class. I can't do the 5 a.m. You're doing 5 a.m., right?
I was doing 5 a.m., but lately, I would say within the last month, it's been hard for me to wake up. And I think it's because I don't have that schedule, like where I have to go to school to wake up, but I want to still start at 5 a.m.
Yeah.
I'll get there. I'll get there again.
It starts your day because for me, I wake up early, of course, Monday and Wednesdays for clinical. And now I added to my schedule to wake up early on Tuesday, Thursdays to go to Orange Theory. So it hasn't been that much of an adjustment. It's been an adjustment, but not crazy adjustment because I've been waking up early for clinical. But now there's a consistency
within your week.
Yeah, and waking up now I'm waking up early every day instead of every other day. So going to Orange Theory has helped with my just stress. And I can't wait to transform. But besides the weight loss side of it, like it has helped a lot because even the trainer that teaches the class, she plays good music where I like into the music. And I'm on and off. I know Kathy and we was working out, but it was like just us two, or I'll go to the gym by myself. It's been a while since I did like a workout class, and I feel like being in a class with other people that
who are doing the same thing. Mm-hmm. I know, because when you see them running, like, because like I have a treadmill at home, right? And I'm like, okay, I can run it, and it's fine, but it's more of a task at home. Yeah. When I go to Orange Theory, there's music, they're bumping it loud. And then they're like, you gotta go all out. And
the trainer's like, you got this, Jazmin, go, girl. And I don't know why I'm doing this, but she has like a little microphone.
She literally said Linda, actually.
Yeah. You said what?
She said, you got this, Linda.
She said that the first time on Monday as well, or Tuesday as well.
Oh, she gave one to you today.
Yeah.
Today she's like, you go, Linda. Linda's heart is not red.
Yeah. Monday, Tuesday she was saying, good job, Linda, go, Linda, da, da, da. So I like that she does that because she keeps like the people that's in the class like engaged.
Yeah,
so
right.
She has like a little broadcaster voice.
She does.
You're gonna do this for 5 reps. I don't know. I'm bad with broadcaster voices. I don't have one. So just being in that room helps a lot with me. And I have Jazmin. She's consistent too.
I try.
And then Kathy's been consistent too. But recently she's been stressing over and preparing for the NCLEX, and now she's going to get ready to go to Columbia. So
how's it been? Because you haven't worked out, right?
No, and I'm going crazy.
Yeah. You feel it? Like you feel not yourself, kind of?
Yeah. And, it's annoying because when I don't work out, I don't know, just I feel like I get like little things irritate me more.
I understand what you mean.
You're stressed. Yeah. You get agitated. Your stress levels is to the roof.
Literally went off on my son this morning because he wanted to eat my pancake.
This is how greedy she is. She weighs her food, okay? So every little crumb matters. Mm-hmm. So she makes these little pancakes. Does not want to give her son any. He's in the back seat. Mom, or what did he say?
More?
Yeah.
And then he goes, poquito.
Yeah. She does not
Honestly, if
want
I
to
was
get-
weighing my food and I barely was eating food, I wouldn't want to share my pancake either.
That's what I said. I'm like, I just gave you breakfast.
You gotta make an extra one.
I know. And
Because
then
food does taste better when it's not
It
yours.
really does. It really does.
and
tastes way
that reminds
better.
me of you this morning when he was like, Mus, and I was like, dang, I should have made him take an extra one.
Now you know. Now you know.
Now you know.
Yeah, now I know. But so I have a little update to do. I took my NCLEX and I finally passed my NCLEX. I took it one time, but I passed my
Yes.
NCLEX.
Yes. She
That's
is
awesome.
a nurse. She is an RN. Congratulations, Kathy.
Thank you.
How was
It
that? How was-
oh, it was horrible. I hated it. I think it was hard for me because I've been so conditioned to take tests at home,
Mm.
and then now taking tests at a facility and all that just gave me more stress.
Mm-hmm.
And I was having like, I don't even know if it was a panic attack. I don't know what the hell was that, but it was like a few days. I want to say, what was it, like Friday? No, it was like days before my test.
Mm-hmm.
And I woke up and I felt like I was too overwhelmed, and I was just having all these emotions, like I wanted to cry, and I didn't know why. I'm like, everything's okay in your life, like what is going on? And I was gonna take like a CAT exam. A CAT exam is kind of like a practice exam that lets you know like how are you, like if you're gonna pass or if you're not gonna pass, or your percentile and how well you did on the test. And then right when I was about to take it, I just started like crying, like literally like water is like, and I'm like, what the heck is going on? So I texted Linda and Jazmin, because Linda has been through the NCLEX, Jazmin has been through the MCAT, and they both been to therapy. So I'm like, they could help me.
Right away when I got that message, I was
Wait,
like,
let her tell you what the message was.
Oh, okay,
You can't
okay,
skip
okay.
the story.
Go ahead.
So I send them a message. I'm like, hey guys, like I want to cry. I feel sad for no reason. I have a ball in my throat. I need to get myself together because I'm about to take a CAT test. And have you guys ever experienced this? Because I've experienced it months ago, but it wasn't like, I usually kind of like ignore it and it goes away. But this time it was like, no, it's like, I'm
You
here
were
to stay.
crying, yeah.
Yeah. So I texted them and I'm like, any tips, any help? Like, I am freaking out. Because it was just me by myself, thank God. So
I'm laughing at this because right away, like, I know exactly how you feel, because I remember I was driving, I think I was picking up Jonathan for work or picking him up from work. He was like, how's your day? And I was like, good. And then I just burst out crying. He's like, what is wrong? Like out of nowhere.
Mm-hmm.
He's like, what's wrong? I'm like, I don't know. Like, everything's okay in my life. Like, I don't know why I feel like this. I was like, I just feel miserable. I feel like just depressed. Like, I was like, I feel depressed. I feel like crying. I don't know what I'm feeling. Literally like you, like out of nowhere. And it was like a week before the exam. And I was like, oh shoot, I think I'm just overwhelmed.
It's a
Because
lot.
I don't know, like you, like I was like not going anywhere, not talking to anyone, not going out, like not giving myself any, like I wasn't working out, I wasn't doing anything, I was eating terrible because I was like, I don't even have time to
You just
cook.
completely lost
I
yourself.
don't have time to cook. I'm gonna eat the quickest thing that is possible. I just was not taking care of myself at all, and I just crumbled. So I knew exactly what you were feeling.
yeah, so and I was like, I don't even have time to work out, like, you know, just like kind of like run it out.
Mm-hmm.
And I was just like, why, what is going on? And then they, like, Jazmin texted me, oh, and then top it off, I got sick out of fucking nowhere.
And she, as you can hear, she's
Like,
still sick.
I'm still sick, but back then I had no voice,
Yeah.
like nothing. And I was feeling sick, but I didn't want to take medications because sometimes like medications make you drowsy, and I'm like, no, I need to like absorb
Focus.
everything.
Mm-hmm.
So
Oh yeah, you got sick literally right before your exam, like 3 days
Yes.
before.
yes.
That's really hard.
So then Jazmin was like, go outside, cold as hell, go outside and take a deep breath. And I'm like, okay. So I put like sweater over another sweater, and I put my headphones and I put music, and I started like walking and taking like a deep breath and just trying to work on that. And then I also felt like I needed to talk to my therapist, because even that whole week before the exam, I was like, you know what, I'm not even gonna go to therapy. Like,
I don't got time.
I don't have time. So I'm like, I'm not even gonna go to therapy. But then I talked to Linda, because Linda called me like to check in. And then she's like, how are you doing? And I was like, no, good. I don't know what's going on. So she talked to me, and then she's like, well, maybe you should at least go to therapy to just get all this stuff out. And I'm like, okay, you're right. So I did it. I scheduled like a quick like session with my therapist, and then that helped me a lot. And like everything you guys told me to do, it helped me a lot. But now then I was okay emotionally, but then now I got sick, and I'm like, damn it, what am I gonna do? And I'm like, because I feel like, and I also had assignments due, because I was like, I'm not even gonna do my assignments ahead of time. I'm gonna wait until like Saturday or Sunday, because I need to study the most I can.
Mm-hmm.
And I will literally like eat breakfast, sit down, open the laptop, stay there until like 4 p.m. just taking practices, and looking at like rationals. Yes. And then get up, go pick up Tiago. On my way to pick up Tiago, I will listen to like podcasts about like pharmacology or Mark Klimek. And then on my way back with Tiago, he will listen to that too. Like,
he's almost a nurse.
Yes. So I'll be listening. So it was not like a break. And then even like TV, because I was like, I need to focus, because I put so much pressure on me, because if I wouldn't have passed, I would have to study in Colombia, and I don't know how things are gonna go over there. I wouldn't know if I would have time to study. So I had all this pressure on
The pass.
on myself, that like, you have this chance and you need to pass. So, and it was the worst mistake of my life that I did the day before the exam. On Saturday, the whole Saturday, I studied from morning to like 7:30. Like, people at Starbucks, the people that work at Starbucks were looking at me like, is she gonna leave?
Or like, there's time for you to go home.
Yeah, it's like, you're here every weekend. Like, and then so I left like around 7:30, and then I went and enjoyed my kid. I'm like, okay, this is my break. And the next day it was my fiance's birthday, and I told him, I'm gonna do something, but in the afternoon for you. In the morning, I'm gonna try to do my homework. So I was finishing my homework, and then I finished my homework, and I'm like, okay, I'm gonna do like a quick test in this website
On the day before the exam?
Yeah, horrible.
You're not supposed to do that.
Worst mistake.
I told that girl
ever.
not to.
This is why my advisors told me about the MCAT too the day before. Remember?
Mm-hmm.
The day before the MCAT, what did I do?
Nothing.
I hung out with you. Exactly. You're not supposed to.
But I have that problem too. I can easily give that advice, but for me, there's not have been a time where I did not study right before.
But isn't it because like you feel like worried?
Yeah. Even though if you, at that point you know what you know, what you don't know, you don't know. But for me, with my mind and how I think, it's like,
no,
I'm gonna get in as much time as. Even the day of my NCLEX, I was like, let me listen to some audios. That should have been like the last thing.
No,
but
I didn't do that.
For me to like calm myself down and to make sure I was properly prepared, it's like, let me listen. It doesn't hurt to listen to a lecture.
So and the day before, so Saturday night, I took 2 CAT exams, and they both said, you pass. And I'm like, I should have left it.
You should have left it right there.
Yeah, you should have stopped, because they play your emotions.
Yes. So Sunday, I took in another website that would tell me like the possibility of passing, and I took it. It said low. That whole thing changed my whole day.
Your mindset.
Everything, dude. And then Carlos was like, do you finish it? And I was like, yeah. And then he's like, what happened? And I was like, he says that I'm not gonna pass. And he's like, no, don't go there. Mm-hmm. And I'm like, whatever, I'm already there. Like,
start spiraling down.
And then, I make him some food. I'm like making like dinner. We're cutting his cake or whatever. I didn't even want to eat cake.
Damn.
And that's
if Kathy don't want to eat, there's a problem.
Yeah, I wanted to throw up. And it was barely 7 p.m.
Should have called me. I would have been like, look, you took 3 exams. 2 of them out of the 3 means you're going to pass. Overall, you're going to pass. So.
Dude. I left the cake, and Carlos was like, you're not gonna eat it? And I'm like, no.
Not you weren't his birthday.
I know.
And I was like, I don't want to eat it. And it was chocolate.
Oh.
So whoever knows me that I never say no to chocolate, or not to cake, or not to ice cream. Or food in general. And I left it. I couldn't. I wanted to throw up. My stomach was like weird. And then he's like, you need to go to sleep. Like, it was like 10 p.m. before 10 p.m. because I had to wake up at 5 a.m. So I go to bed at 10 p.m. My head is not shutting down. Like, it just keeps like you kind of forget that I have the test, and it's like, no,
Nope,
you have
I'm right
the
here.
test. Yeah.
Yeah.
And then I'm like, oh my God, I need to like shut it down. Carlos slept with Tiago that night because he's like, I don't want him to bother you. So you sleep by yourself in our bed. You would think I should have enjoyed it because I have space. But no. So I woke up, like in the middle of the night, and then I keep like waking up.
Tossing and
Yes,
turning.
yes.
That was me.
And then next
Same.
thing you know, I feel like I slept a little bit too much. And then I'm like, I wonder how much I have, like how much
Time you have?
time I have left until like my alarm sounds. Looked at it, dude, 5:15. And I was like, oh my God. I did not hear my alarm
Oh wait, so what time did you have your alarm set for?
at 5 a.m.
Oh.
I said she got saved because she only missed 15 minutes. She could have slept through
the whole thing.
Yeah.
Dude, horrible.
I did not know that happened.
Yes.
Oh,
So
heck no.
I woke up, shutting pain on my eye. I have the biggest headache of my life, like hangover.
And now you're just rushing in
Dude,
shambles. Oh, that's
hangover,
terrible.
like headache, which I didn't drink, nothing.
Yeah.
Like it was, I just had a worst headache of my life because I suffer from migraines. And then I get a little like my stomach started hurting, and I was like, oh hell no. What happened? TMI, I got diarrhea. So,
Probably the stress too.
and then dude, it was like over. Like,
Oh.
and then my daddy's texting because my daddy's taking me. He's like, where are you? And I was like,
Who
"Getting
did, my
ready."
whole thing, who didn't wake you up at 5 a.m.?
The alarm.
You had, no, your
Oh.
alarm set, but if
I
I
would've had other people
I would have
in the
had
house
other
up.
people wake me up.
I messed up. I should
Yeah.
have let them know.
No, I do the same thing. I'm like, hey, tomorrow's a very important day. I need to be there. If I don't wake up, you need to wake up. We need a. You're my.
Especially if you sleep
yeah.
through alarms.
Yeah.
I don't sleep through alarms. I
You
wake
sleep
up.
with alarms?
No, I never do.
Oh, dang.
And then that's why I'm like, how come I didn't listen to it? Because hello, ever since I have Tiago, my sleep is very light. Like he moves,
Yeah,
and then
you
I wake up. So I'm like, what the heck? So
The devil try to get you.
yes. So now I have diarrhea, and I'm like, oh shit, that I got sick from the food that I prepared last night. Because I specifically didn't want to go to a restaurant because I didn't want to get sick.
Yeah.
So I'm like, did I get sick? And I'm like, because I did like a garlic butter to like do like garlic bread, and I think it was too much garlic.
Yeah, even like the butter,
And
maybe.
yes,
Yeah.
and then so I get ready. I get out. We had to get out like at 6 a.m. And then I got out at 6:05. I was like, sorry, Dad. And he's like, no, I have everything ready for you. Like, we gotta go. And I'm like, okay. And then he's like, we're just gonna pass through like a coffee shop, and then we're gonna get you something to eat, and then we'll, on our way over there. So we're going, and there's like a mountain. There's no bathrooms. There's nothing around there. I'm talking to my dad. I'm still feeling sick, but I'm not telling him anything because I don't want him to freak out, because then he's gonna freak me out.
Mm-hmm.
And then I get my stomach, dude. I was like, I need a bathroom now.
Oh,
And then
shoot. You know it's bad.
Dude, my dad was like, oh my God, hold it. And I'm like, I'm trying. Like,
Oh,
I need a
thanks.
bathroom now.
Clench those butt cheeks.
Dude. Right when he like drops me at the coffee shop, I run to the bathroom and bam.
Oh, you
and I
know
was
it's
like,
bad.
I was like, this is not good. And my test is like in an
Oh,
hour.
And, you,
And
yeah.
I'm like, what am I gonna do? What
I'm
am I gonna
stressed
do?
out for you.
They're strict at the testing center.
Yes, they are super strict. And I always keep it on my mind. Like, they take away from your testing time.
Mm-hmm.
So I'm like, I cannot be at the bathroom the whole test.
Mm-mm.
Because I don't know how many questions I'm gonna get.
I would just stay on the chair.
Dude.
You know?
You can stay on the chair.
You gotta do what you know. People who wear diapers and stuff.
Oh,
like
heck
that.
no.
You know people.
No,
wait,
I don't care what
wait,
people do. No.
Do you know that?
No.
Did you know that?
No.
Did you know that?
No. Mm-mm.
No. Did you know that though?
No.
No.
People wear diapers and stuff for the MCAT.
That's uncomfortable.
That-
like, my
no.
mind wouldn't be able to even think about.
No,
even if
dude.
I had a diaper on, I
I
wouldn't
would
be
think
able
about
to
this
go.
man.
I can't
like,
believe
In
that.
the pee-
No,
no, no, absolutely not. So that's what you meant by like, sitting there.
Yeah.
Oh, no.
No. So,
Because you can't reschedule, right?
You can reschedule.
You can reschedule.
Yeah.
but I don't have time.
She didn't have time. She's going to Columbia.
Yeah.
But you can reschedule up to a week after Philly.
Yeah.
No. Like, let's say you get sick.
Oh, you'll lose your money
Yeah.
unless you put like a deposit, not a protection or something.
And that's $600 you will lose.
Mm.
So then my dad was like, stay here, go to the bathroom. I got you some bread, and I'm going to get you some Pepto. So he got me some Pepto. I took the shot of Pepto, and I'm like, Lord, help me. Because I already had taken an ibuprofen for my headache. So the headache was already going away. But then I had this issue. So we get to the testing center. Like, I had to be there by 7:30. We got there like around 7:05. And then we were just cruising around. And then I go into the testing center and I start freaking out. And I was like, okay, calm down. And then I only brought my phone, my ID, and my chapstick, and my headphones. That was it. And then the little ones, AirPods. And then I go in, and then I go up, and then I'm like already sweating, and I'm like, oh, this is not happening. And then I'm all congested, and I'm like, ugh. And then they call me like, why come in? They're like, take a number, and then tell me what test you're here for. I listened to that, but my dumbass took the number and keep walking. And then he's like, so what test? Oh, I was like, oh, I'm so sorry. Yes, I'm here for the NCLEX. And then he gave me the rules, and I'm like sitting there, and then there's this girl talking like, yeah, I'm an LVN, and I was here 10 years ago, and now I'm gonna take my NCLEX, and you don't know when you're gonna pass, and blah, blah, blah. And I was like, okay, cool. So I go to the bathroom, come back, then they take me into like where it is. And then they pat me down, they look at my glasses, everything. And then I give him my phone, like everything's in a locker. And I'm like, I do have a runny nose. I brought Kleenex. Throw those away. We'll give you some. And I'm like, okay.
They do not play.
Yeah, I know.
Yeah.
Ooh, we should have like an episode on like how to like going into the exam and like that, because that setting itself is very stressful.
I agree.
What you need to do to prepare to even take the exam, very stressful. The whole process of what you can't bring to the exam room, what is expected of you for the exam, that's in itself.
And then so then I go in, they give me like some headphones or whatever. I go in, I looked at it, and I'm like, bro, what is this? I know it's not A, I know
That's
it's not
always
D.
that's always the first
It's between
one.
B and C, but I don't know which one's the best answer. So I start thinking, and I start looking at time. All of a sudden, dude, like in like 30th question, I start falling asleep. I'm like, bro,
you know it's bad.
I'm like, this is not happening right now.
Kathy.
I was like, this is not happening. I'm like, because of course I didn't drink coffee because I got the run, so I couldn't.
Oh yeah, there's no way.
Yeah.
So I was like, this is not happening right now. And then whenever I do feel like I'm falling asleep, I drink water. But guess what? My water bottle is in the locker. I'm not gonna waste time going all the way there. So I was like, I started talking to
Kathy's like,
yeah. I'm like, you need to wake up. You're in 30 questions.
And you got
need to keep
100 more to go.
Yes. So I keep going. And then I go to 83, and I'm like, oh my God. And then I keep going. And then there were some questions that I guess my not strongest suit was pharmacology. Like pharmacology I was struggling with. And there was a question that gave like different type of medications. There was this medication that I didn't even know what it was.
They do that on purpose.
And I hated it. And I was
They do that on purpose.
I don't remember. It's not a beta blocker. It's not a calcium channel blocker. I'm like, I don't know what it is. And I'm like, well, if I don't know, then maybe this is the correct and like this is the wrong because it was like a wrong medication. So I was like, maybe it's this. I don't know. Yeah. And then it goes to 84, and I click next. Then it goes to 85, and I'm like, I fail. I fail. Like he's gonna give me more questions. Like I'm pretty sure because I felt like I didn't know what I was doing.
Yeah, you're guessing the whole time.
How many does it go up to?
Whole time.
250, 150.
It's either 245. I think it's like 245 or 145.
Yeah. So then I'm waiting for more questions, but guess what, guys? It closes. And I'm like,
it closes at what?
Like at 85. Like after I clicked next to 85, I'm waiting for 86. 86 never came. Dang. And I'm like, oh God, I failed.
What's the lowest you can finish at?
85.
Damn girl!
Yeah. She's a smarty. She passed at 85.
Yeah, but I was not feeling smarty at all.
People, that's the thing. They give you questions that you've never heard of just to test your knowledge because they go up and down.
Yeah.
It makes you feel, honestly, because like I haven't taken the NCLEX, but I took the EMT one because it's that way where it finishes. And I literally called Uber and then had Jonathan call Uber, and I called him like, hey, I'm done. He's like, you're playing with me. And I was like, no, like I'm done. He's like, no, you're not. I'm like, no, like I really am done.
No,
and
dude.
Just imagine if you had to continue to take your exam. You have diarrhea. I don't know if you still had a headache. You're falling asleep at 30 questions. Just imagine if you had to take the whole exam to 200 and something questions.
No, dude.
Yeah.
And then, like, I finished around 9. I looked at the clock, 9:30. And then I was like, oh my God, I failed. Like, I texted Linda and I was like, I don't know how to feel. Then she's like, what do you think? And I was like, I failed. She's like, when did you stop? And then I was like, 85. And Linda's like, you're smart. And I'm like, no, dude, I failed. Like, I started crying. Like, I'm going down the elevator. I got out of there because obviously I didn't want to see me cry. So I got out there and I'm waiting on the lobby for Carlos to come and pick me up. And I'm like crying and crying. And I was like, oh my God, what am I going to do? Like, I failed. I feel like I didn't feel like smart enough.
Yeah.
And then...
And I knew you didn't fail because in order to fail at 85, you have to absolutely know nothing.
Yeah.
Like, and I know you were putting in the work behind it. So I was like, there's no way you failed at 85. If anything, if you were struggling a lot, they would have kept you going until 200 or something. They wouldn't fail you at 85 unless you didn't know nothing.
Yeah.
Yeah.
So I'm like, I'm
really proud of you. Really proud of you.
But that feeling sucks about, because literally the whole time you're taking an exam, you feel like you're guessing. Like every person I talk to, they'll say like, oh, even me, I feel like this stuff didn't have anything to do with what I studied and how I practiced. So the whole time I was guessing.
And now that's what it got me so mad because I did a lot of questions a day, a lot of them. And then all this studying, and I'm like, it didn't get me ready for not even one question. Like,
you felt that way.
Yeah,
you felt that way, but obviously you were because you passed.
You passed.
Yes,
but that's why I feel, because that's a normal feeling, like feeling like you failed, because it's a weird test. But I feel like we should have an episode maybe like next week or something where you can talk about how you prepared the material, because you mentioned listening to certain like lectures and stuff, and I feel like that'll be helpful.
Yeah, definitely. I want to give somebody that's in my that's working through the NCLEX tips, because I feel like I have some shortcuts that because some people are giving me like these long things to do, but keep in mind I'm a mom.
Yeah, no one got time for that.
So I have to, like, whenever I'm not doing something, then do something else. So I'm more than happy to share like tricks
you should.
that they could incorporate.
Because it would be really helpful, because I took the older generation. Like, I was the group that took the last of the older generation, and Kathy, she's of course doing the new generation of NCLEX. So I feel like, yes, I can contribute, because a lot of the materials you use, I use as well, but I don't know how the new generation exam is.
Right.
So that'd be awesome.
I'm down for
I'm
that.
so proud of you.
So yeah, guys, that was my
She's
story.
a smarty. She passed at 85.
I know.
Yeah, I still can't believe it. But yeah.
Put some respect on your name.
Exactly.
You worked your butt off.
Yes.
For me, what am I doing?
What am I doing with your life, Jazmin?
Honestly, just prepping for interviews, because I got an interview and I'm really excited about it. I'm like, I want to go here. I'm really excited. And interviewing is not like my strong point. Like, I'm not good at interviewing. I'm not good at even just like being on the camera on Zoom. That bothers me. That I don't like the camera.
This. Yeah.
Yeah, it's just the camera bothers me. But just really reaching out to people and really just asking for help, because I cannot practice an interview by myself. Like I can have a question and practice it, but I won't know how I do it because I'm speaking it and I can't really like pay attention to what I'm saying. So like I need feedback, and I can't give myself feedback when I'm talking. So it's really hard to practice interviewing without having someone there. Yeah. So just asking my friends, asking people from my old cohort at the post-bac, meeting with my advisors as much as I can. I've been doing that. Even like I reached out to Vanessa, and that was really helpful. I reached out to another medical student who I met in the MMI process, and I reached out to him and he helped me. We had a session as well. And then I was like looking for resources, and my friend sent me some free resources. Like the school, it's USC School of Medicine. They have basically they're offering like a MMI, a practice MMI, and I signed up for that, and so I'm gonna do that this weekend and just go through the MMI process with them. Although they denied me, or they rejected me.
They did
the school.
Oh, the school itself, but they still allow you to go do like the free workshops.
Yeah, so I'm doing a free workshop there, and I'm gonna practice the MMI there, and I'm just trying to like feel more confident with interviewing. It's hard for me. I don't know, like I think just doing it with different people makes me feel comfortable because it's uncomfortable.
Yes, and it gets you more uncomfortable, but in the end comfortable when you're able to switch up the person, because it's like we're close. Maybe someone else that you do the practice interview, maybe you won't be as close. So like the more like diverse you are within like the people who's asking you questions, the more prepared.
So literally just putting myself in situations where I'm not feeling comfortable so that I can practice what it's going to feel like to actually do that interview. But I'm also just trying to be like, be yourself, Jazmin, like, because that's what everyone's saying is like, just be yourself. I'm like, I get that, but it's really hard for me to do that in the interview process. And they're like, well, they already like you if you already got the interview. I get that, but still.
It's easier said than done.
Yeah, definitely.
Because yes, you want to be yourself, but then you're also selling yourself. And then you also know this is an important interview. So all of that still adds a layer of stress where it's like, you can't really be yourself.
Girl, not a layer. There's like 5 layers.
Yeah, you know, I was trying to be Jenny.
But yeah, I hate interviews. Like I cannot be myself. And I'm just trying, like I practice interviewing pretty much every day. And it's helping. Like I can see improvement, but like it's not the improvement I want, but it's slowly getting there. And even like my advisor was telling me, because basically in March, people are, you know, getting acceptances and everything, and people are responding back to schools. And the school that I'm interviewing at, the date I have is really late. Like it's pretty much at the end. I think my friend said that it's basically like I have like the last interview days like that the school has. And my advisor was even like, oh, email them and ask them for an earlier date. And I was like, okay. And honestly, the first thought that I had was, that's not happening. I'm not doing that because I'm not ready. And like, I know myself really well. Okay. I know myself really well. I know when I'm ready and I know when I'm not ready. And right now I'm not ready. I just need like another week to really, you know, practice. But that's where I'm at right now. And I'm kind of excited that I'm like listening to myself because I'm already seeing like the improvement slowly. Nice. And she says she trusts my judgment. So I'm going with that. So
nice. Do you feel that your interview techniques or like it's changed, like anything's like different from like what you were doing before to now?
Yeah, they've changed a lot.
If so, we should also have like an episode of you giving listeners basically tips of how you prepare for interviews and the things that you've done differently, because I know we've talked about it a little bit.
Honestly, no, I think it would be very helpful for people who are applying to medical school because I've learned so much about the process. And I have so many things I just want to vomit right now.
Yeah, so I feel like that can be like an episode in itself.
I think that will be really good because I think half of it is getting that interview and selling yourself on paper, but the other half, honestly, is just in person. And like I said, I can be myself, but I can't be myself if I don't know how to interview. And so I think it's really important if you're applying to medical school that you take the right steps to prepare for the interview. And I'm excited. Yeah, we should do one.
Yeah, and I think like her sharing like the free resources that are out there, because I know medical school application and everything is very
not even the free resources expensive. Not even, I mean that too, but even like the way I'm preparing, like I have notes when I take interview, like before I take interviews on like the school and stuff, but on top of that I have other stuff that I do to prepare for my interview, and I think that'll be
a great episode.
I think so.
I agree.
Yeah. So those are our updates for now. Like we said, that every now and then we'll give random life updates, maybe hopefully once a month. So it won't just be super structured, or the episode is super structured, and give an update on how we stressing over here.
We're doing this for you, Jonathan.
Jonathan?
My partner.
Oh my God. Well, there's multiple Jonathans. I thought you were referring to a different Jonathan.
No, because you know how I told you he was like, you guys need to do this.
Oh yeah, he said we needed a producer.
Yeah. He said we need a producer, and he said we needed to be more like just us. You know.
Yeah, which we try to do.
Yeah, we try.
Yeah, but I know there's a few episodes where it's more like educational.
Yeah.
Because we want to do education and also just talk as well.
And I honestly really really also enjoy like the educational ones because I learn a lot through them too. Like,
Right.
you know,
Because
so
that's having to do research.
Mm-hmm.
yeah,
That just stresses me. I enjoy them too, but it's stressful because it's like, dang, I have to do research from school and study for school and also research
You
for
know
the
what?
podcast. But it's helpful.
I can totally understand that because I'm not in school right now too. Like, for me, it's like not as bad, but I think it was complicated more by like the whole fact that Kathy's leaving. We just had to like do so many at once.
Literally
you know
recorded
what I mean?
3 episodes in 2 weeks.
Yeah.
Not 3. Did I say 3 episodes? 13 episodes.
Yeah, 13
in a
episodes.
week.
Yeah, that was rough, but we did it.
We did it.
When we work, what happens when you work as a team? Ooh.
Bye.
Bye.
Thanks for listening to this episode of PD3 with your hosts Linda, Jazmin, and Kathy. Make sure you like, comment, and subscribe at a potent dose of 3 so that you never miss an episode and your weekly dose.